Alright, so today I'm going to do an airway clearance. So that way I can get them to cough up anything that are in their lungs. That way they can keep their lungs open, especially if they're bedridden or anything like that. So I'm going to check the patient's chart to see if they have any nebulizer treatments. So I'll do the nebulizer treatment, and then after those treatments I would do this treatment with an acapella is what we have today. So this acapella, this has like a flutter valve, so it's going to make basically like a fluttering in the lungs, and it'll make the patient cough up any secretions that they may have, and it'll help them cough, clear out their lungs. So first off, I always have to check to make sure if they are an elderly patient or anything like that. So beforehand, before I'm ready to do the treatment, I always check to make sure the patient is the correct patient, and I always listen to their lung sounds and their vital signs and make sure my hands are clean. So when I'm ready to give it to the patient, after I got done instructing the patient what it is and what I'll be doing with it, so I'll set it at the lowest resistance to see where they're at, if they are able to get that good expiration out to make them cough up. And then I would place a mouthpiece on here that comes with the package. There'll be a mouthpiece, and you can even, there's some masks that you can get in the chart. There's different masks that you can place on. Never put the medication on the end of this, just because it can clump and it won't work properly after a bit. So when they're ready, I'll have them hold it kind of like a microphone here, and then I'm gonna have them take a nice breath in, and then about a 1-to-3 ratio or 1-to-4 ratio. So I'm gonna have them take a nice breath in, and then when they exhale, I'll have them do a nice good exhale, about 3 to 4 seconds, around there. So when they're ready, I'll have them take a nice breath in, and then exhale, and then so with this, if they feel a resistance, tell them to continue on. That way it does the full treatment that it needs to do. So with the acapella, it should be able to help them open up their lungs. If they didn't quite cough up, then I can increase the resistance up more if they didn't get anything out, and make sure they're getting that proper seal around the mouthpiece to cough, get the nice breath in to be able to cough everything up that they need to. Now, if they have coughed up anything, I'll have like a little cup or a basin that they can cough into. That way, after treatment, I need them to cough up stuff. That way it clears out their lungs. And then I will chart down to what the consistency of what they cough up, if it has an odor, how much they coughed up, and if it has any distinctions to what they coughed up. And when I am done with the machine, I will set it off. It comes with a bag. So on this bag, you can write down the patient's name and the room number. That way they can keep it for when they go home and continue to practice to keep their lungs strong to be able to cough up everything. So I'll place it in there, and you can set it next to their bedside, or you can just set it on the counter if they are done for right that time. So with a patient, I try to do about no more than probably 10 times, just because you don't want the patient to pass out, especially with acapella. The lungs can get overworked, and then you'll do about 10 to 20 minutes every hour, just to get their lungs continue to strengthen to be able to get that secretions out. So when I am finished, I will wash my hands. If I have a sputum sample, I'll make sure that gets to the lab. I'll reassess the patient, listen to their lung sounds, see if they sound better, see if they're clearing up, and then I will chart down the vital signs. And then I'll reposition the patient. With acapella, I'll always have them sit up. That way they get a good, nice inspiration and exhale out. And then I'll reposition them, set anything next to their bed that they may have there. And then I'll wash my hands and go chart everything. If they have any samples, then I'll chart that in their charts that they coughed up some secretions.